Hi everyone, welcome again to my channel. This is the 6th video on anatomy and physiology. This is a supplementary exam to help you with your course. So let's start. Question: which cardiac conduction have the slowest rate of firing? Is it the bundle of His? Is it the Purkinje fibers? Is it the atrioventricular bundle? Or is it the bundle of branches? The answer is the Purkinje fibers. Purkinje fibers is located in the inner ventricular walls of the heart beneath the endocardium. They are specialized myocardial muscle fibers which conduct electrical impulses which allow coordinated contraction of cardiac muscle. Purkinje fibers may work as a pacemaker when the sinus and the atrioventricular nodes fail to function properly, resulting in ventricular escape rhythm or idioventricular rhythm at a rate of 30 to 40 beats per minute. Next question: what is the study of body parts visible to the naked eye? Is it anatomy? Is it gross anatomy? Is it physiology? Or is it pathophysiology? So the answer is gross anatomy. So gross anatomy is the study of the major body structures by dissection and observation without the use of microscope. Macroscopic anatomy is another name for gross anatomy. So the body's ability to maintain to its normal state is what? What is the name of it? Is it the induction? Is it homeostasis? Is it catabolism? Or is it resistance? The answer is homeostasis. So homeostasis is the process where stable internal environment is maintained in the body so that cellular metabolic functions can proceed at a maximum efficiency. Homeostasis is maintained by muscles or glands that are regulated by sensory information from the internal environment. Next question: male hormones are produced by which of the following? Vas deferens, spermatic cord, epididymis, or testis? The answer is testis. The testes are two small organs found inside the sac of skin of scrotum. The scrotum hangs outside the body in front of the pelvic region near the upper thighs of males. The testis function is for making sperms or spermatozoa. The male gametes and synthesizes testosterone, which is an important hormone during male development and maturation for developing voice, muscles, and growing hair. Next question: which structure has the thickest wall? This is in the heart. So is it the right ventricle, the right atria, the interatrial septum, or the left ventricle? And the answer is the left ventricle. So the left ventricle has the thickest wall. It is the main chamber of the heart. It is responsible for pumping oxygen-rich blood into the aorta, which is the largest artery of the body. If the heart has to work too hard, the muscles in the walls of the left ventricle thickens. If the left ventricle failed, there will be an impairment of all other organ system. The most common cause of left ventricular failure is coronary artery disease from long-term hypertension. It may lead to myocardial infarct if not resolved. Next question: the anatomical regions of abdomen distal to the sternum is lumbar region, iliac region, hypogastric, or epigastric. So there is the sternum. And which region? The answer is epigastric. So epigastric region is located in the central upper abdomen distal to sternum. Next question. It is the study of tissues. So what is it called? Is it biology, histology, pathophysiology, or anatomy? The answer is histology. So histology is the branch of biology that studies the microscopic anatomy of biological tissues. It is also known as microscopic anatomy or microanatomy, which is the counterpart of gross anatomy, which is the study of larger structures without the use of microscope. Next question. The formation of gallstones is called cholelithiasis, pancreatitis, cirrhosis, or epididymitis? The answer is cholelithiasis. So cholelithiasis is the formation of hardened deposits within the fluid of the gallbladder, a small organ under the liver. Gallstones can have different sizes and numbers. Some common reasons for the formation of gallstones are metabolic disorder, hypercholesteremia, diabetes, or obesity. Next question. When a medicine is delivered via a patch attached to the skin, it is said to be delivered transdermally, subcutaneously, topically, or intramuscularly. So the answer is transdermally. So some medicines can be absorbed through the skin to enter the bloodstream. Next question. What is the outer region of the kidney? Medulla, major calyx, minor calyx, or the renal cortex? And the answer is the renal cortex. So the renal cortex is the outside region or the covering of the kidney. The cortex surrounds the inside of the organ, which is called medulla. So the major function of the renal cortex is to synthesize the precursor of creatinine. Next question. What is the function of lacrimal glands? Is it for secreting the aqueous portion of the tear film? Is it for providing protection and lubrication of the eye? Or does it prevent microbial entrance? Or could it be to control and focus the entry of light into the eye? So the answer is secreting the aqueous portion of the tear film. So lacrimal glands produces tears. They secrete the aqueous portion of the tear film. Next question. Which one is the pacemaker of the heart? Is it the sinoatrial node, AV node, Purkinje fibers, or the bundle branch? And the answer is sinoatrial node. So this is the pacemaker of the heart. It is a cluster of myocytes with pacemaker activity. In normal circumstances, it generates electrical impulses that set the rhythm and the rate of the heart. Next question. What are the two layers of pleura that surrounds the lungs? Are they the visceral pleura and mediastinum? Is it the parietal and mediastinum? Is it the visceral and parietal pleura? Or none of them? And the answer is the visceral and parietal pleura. So there are two layers of the pleura, the visceral and parietal. The inner layer is the visceral pleura, which covers the lungs, blood vessels, nerves, and bronchi. The outer layer is the parietal pleura, and attached to the chest wall. This is the end of this video. Please like and subscribe or comment below so I can continue making similar videos to supplement your studies in anatomy and physiology. Good luck and thank you for watching.